Hi, I'm Dr. Emily Carter. If you've noticed that your ankles, hands, or face feel puffy at the end of the day, or if you wake up in the morning and feel unusually swollen, you're not alone. Many people over 40 experience subtle or pronounced fluid retention, and it can be confusing because it often appears without a clear cause. You might feel healthy otherwise, exercise regularly, and watch what you eat, yet still notice swelling. So, why does this happen? First, let's understand what edema or swelling actually is. Edema occurs when fluid accumulates in your tissues. Our bodies are mostly water, and the balance of water inside and outside your cells is tightly regulated. Normally, your kidneys, blood vessels, lymphatic system, and hormones work together to keep everything in balance. But as we age, or due to certain lifestyle factors, this balance can be disrupted, leading to fluid retention. One common reason for swelling is diet. Foods high in sodium, like processed meals, canned soups, fast food, or salty snacks, can cause your body to hold on to water. Even small increases in salt intake can result in noticeable puffiness, especially around the hands, feet, and ankles. On the other hand, diets low in potassium can also contribute. Potassium helps balance sodium levels and encourages fluid excretion through the kidneys. Eating more fruits and vegetables like bananas, spinach, and avocados can help your body maintain this delicate balance. Hormonal changes after 40 are another major contributor. Women, in particular, experience shifts in estrogen and progesterone, which influence fluid retention. Many notice swelling before or during their menstrual cycles, but after 40, these hormonal fluctuations can continue in a different pattern, causing unpredictable puffiness. Men can experience mild fluid retention too, often related to changes in testosterone levels or other metabolic factors. Physical inactivity also plays a big role. When you sit or stand for long periods, gravity causes fluid to accumulate in your lower extremities. This is why swelling often appears at the end of the day or after long flights. Your muscles act like pumps that help move fluid through veins and lymphatic vessels. Without regular movement, this pumping mechanism slows down, and fluid starts to pool, particularly in the ankles and feet. Gentle daily walking, stretching, or simple leg exercises can make a big difference in circulation. Certain medical conditions may also contribute to fluid retention. Heart, kidney, or liver problems can all disrupt the body's natural fluid balance. Medications, including some blood pressure medicines, anti-inflammatories, and hormone therapies, can also cause swelling as a side effect. While most fluid retention is mild and lifestyle-related, it's important to pay attention to sudden or severe swelling, especially if it is accompanied by pain, shortness of breath, or other unusual symptoms. Always consult a licensed healthcare professional if you notice these warning signs. Inflammation is another subtle but important factor. Low-grade chronic inflammation can make tissues more prone to holding water. Factors like poor sleep, stress, high sugar intake, and sedentary habits all contribute. Even if you feel healthy and active, small inflammatory processes in your body can make you more sensitive to fluid retention. Managing stress, sleeping 7 to 8 hours per night, and eating a diet rich in anti-inflammatory foods can help reduce this hidden contributor. Now let's talk about simple, practical steps you can take to reduce puffiness and improve circulation. Increase movement. Even short walks, gentle stretching, or light strength training throughout the day help move fluid out of your extremities. If you sit at a desk, stand up every 30-45 minutes, do ankle circles, or flex your feet to encourage circulation. Elevate your legs. When resting, try to keep your legs slightly elevated above the heart level for 10-15 minutes. This uses gravity to assist your body in moving fluid out of your feet and ankles. Stay hydrated. While it may seem counterintuitive, drinking enough water actually helps your body release excess fluid. Dehydration can trigger your body to hold on to water, worsening swelling. Aim for consistent water intake throughout the day. Mind your diet, reduce excessive salt and processed foods, and increase potassium-rich foods. Small changes like swapping chips for fruit or adding leafy greens to meals can have noticeable effects. Wear compression socks or sleeves. These can help prevent fluid from pooling in the lower legs, especially during long periods of sitting or standing. Massage and self-care. Gentle massage or foam rolling can stimulate lymphatic flow and reduce fluid retention. Focus on areas like ankles, calves, and hands. Check medications and supplements. If swelling persists, review any medications with your doctor to see if they may be contributing. It's also important to understand that swelling isn't always visible. You might feel tightness in rings, shoes, or clothes, or notice puffiness in the morning that disappears as you move during the day. These subtle signs are still important and indicate your body is holding fluid. Another factor many people overlook is sleep position. Sleeping with your legs slightly elevated or avoiding prolonged pressure on certain areas can reduce morning puffiness. Changing sleep habits slightly, such as avoiding excessive salt in the evening or adding gentle stretching before bed, can help reduce fluid accumulation overnight. Lifestyle habits make a huge difference. Regular movement, balanced diet, adequate hydration, and stress management together create a system that naturally prevents fluid from pooling. Even small, consistent steps, like a 10-minute walk after meals or swapping salty snacks for fruit, add up over time. Finally, remember that your body uses swelling as a signal. Mild fluid retention is often a sign that circulation, diet, or movement patterns could be improved, not a sign of inevitable decline. By paying attention to these signals and responding with simple lifestyle changes, you can dramatically reduce puffiness, feel lighter, and improve overall wellness. To summarize, here are the key takeaways. Fluid retention is common after 40, often caused by diet, hormones, inactivity, and subtle inflammation. Movement and circulation are critical. Sitting or standing too long makes swelling worse. Simple habits like proper hydration, potassium-rich foods, gentle exercises, and leg elevation help a lot. Severe or sudden swelling should always be checked by a doctor, but most everyday puffiness is manageable at home. If you found this video helpful, subscribe for more practical guidance on joint health, mobility, and wellness after 40. In the next video, I'll share simple daily routines to improve circulation and reduce swelling naturally. I'm Dr. Emily Carter, and I'll see you next time. Take care of your body, it carries you through life, and small, consistent steps today make a huge difference tomorrow.